Welcome back to the Island Docs. If you are now joining us, we've been talking about Ebola virus, dengue virus, and the chikungunya virus. Now, the chikungunya virus really does affect everyone, but most that we are concerned about are the very old and the very young. Why it is that we're concerned about them is because their immune system makes them more susceptible to infections. So what would be a minor case might be something worse in someone that is older or someone that is younger. So if you have older parents that live with you, or you have a young baby or a young child in your house, it is very important that you need to protect them from being bitten by this mosquito so that they are not susceptible to the chikungunya virus. Now, there are some differences and similarities between the chikungunya virus and the dengue virus. We both know that they are both caused by the Aedes aegypti mosquito. But with their incubation periods, the chikungunya virus, it's a bit shorter. It takes about 3 to 4 days before you see symptoms. While with the dengue virus, it takes 4 to 7 days before you can see symptoms. Now, their signs and symptoms, as we said before, are the same: viral prodrome, headaches, fever. But with chikungunya virus, you rarely ever see bleeding, while with dengue, you see bleeding very commonly. And we doctors do the test, we do the diagnosis with the same kind of test. It's an IgM serological test to see whether or not you have chikungunya in your system or if you have dengue in your system as well. And the severity of it, it's a little bit different. Dengue virus has a higher fatality or higher severity than the chikungunya virus. And we both know that the interventions and, the treatments are the same: bed rest, fluids, and, Panadol. But you should definitely refrain from taking aspirin, ibuprofen, or any kind of blood thinners while you have chikungunya virus or dengue virus.
We cannot have a show about viruses without mentioning the influenza virus, also known as the common flu.
Yeah, definitely. It affects so much of our population, especially the elderly.
Yeah, the influenza virus, we all get our flu shots every year, but the patients most at risk are the elderly and the young.
Yes.
Also those people who are immunocompromised, people with diabetes, hypertension, lung diseases. Influenza virus presents similarly to all the viruses that we've mentioned before, but not to the same degree. That is why we get our flu shots, because when you get it, then the ability for it to affect you is very, very reduced. And that is why we get our influenza vaccine every year, because you really, really want to protect the elderly and those young people, people who are generally immunocompromised, people who have diabetes, hypertension, maybe sick because of some kind of pulmonary problem. Those are the people that really, really need to be vaccinated. And of course, healthcare workers, because they are dealing with the sick and the infirm. There's one other virus that I'd really, really like to talk about, and it's the yellow fever virus. It is similar to the dengue and the chikungunya viruses, that it is spread by mosquito in the same family. Now, it's also similar in having the same
sequela.
Yes, it has the same sequelae of infection, which is the same general headache,
yes,
fever, malaise. The thing is, this one can run the gamut of being asymptomatic all the way to the hemorrhagic fever.
So this one is also another hemorrhagic fever, like a virus that causes hemorrhagic fever, similar to dengue, similar to the chikungunya virus, and also similar to the Ebola virus. So you see the trend that we're seeing here, that these viruses that are spread by these mosquitoes are causing hemorrhagic fevers in the very severe cases and a viral prodrome in the very, very mild symptoms.
Now, the difference between the yellow fever and to the others that we've spoken about before is that the cases that you would see of yellow fever in the Caribbean are actually very, very small.
Yes.
Reason being is because there's a vaccine. There's a yellow fever vaccine, which you get as a child. Mm-hmm. So because most of the population is vaccinated against yellow fever, you will not see yellow fever being presented in the hospital, or most people will just never come into contact with yellow fever.
Yeah, that's so true. So what we're trying to say, guys, is that if you do have any of the symptoms that we described before, if you're having fever, you're having generalized malaise, you're having this tiredness, joint pain, aches, you're seeing rashes appearing all over your body, and you live in an area that is predisposed to a lot of mosquitoes, you should be thinking at the back of your mind, do I have dengue? Do I have chikungunya? Should I go in? I should go in to see a physician and get myself tested and drink a lot of fluids. This part that is coming up is very, very important. You you have to pay attention, because we are going to give you some of the tips, you know, what to look for in your yards, how to prevent or lower the mosquito infections. Because if we eradicate the mosquitoes, we have a handle on these viruses. So we're going to find out how to eradicate these mosquitoes or how to prevent ourselves from being bitten. So see you after the break.